ready?
Do it.
All right. Hi, even though you're seeing Dr. Ruth Westheimer, unfortunately, we can't hear her. I'm Liz Krueger. I'm your host this evening. We were hoping for us to be able to hear from Dr. Ruth, but there's something wrong with the video. So, unfortunately, I'll just have to thank her for submitting it, but explain that I couldn't quite get it to work. The reason I was pleased to have Dr. Ruth offering greetings at the beginning of our town hall tonight is because she has always been able to challenge the culture that allows ageism and ableism, discrimination against people with disabilities, to flourish, because she lives her life with passion and is always eager to discover and learn things about the world and its people. Dr. Ruth was a friend of my now deceased parents, and I will never forget the first time I found a pile of her books on sex in their car when I borrowed it, and was like, Mom, Dad, why do you have all these sex books in here? They told me they met this fabulous woman, Dr. Ruth Westheimer. And that was probably the beginning of the ongoing relationship between her and my family. And again, she couldn't be with us tonight, but she did want to send her greetings and her support. And she even implied she'd be giving us a test afterwards, so you better listen carefully. Just some opening announcements before we get to tonight's town hall discussion. One, I'm glad you're all able to join us, and I hope that everybody's staying safe and healthy. I want to talk about the census because it's really becoming an urgent issue. New York does not have enough people answering their census questionnaires. That matters to every one of us because the amount of money we get from the federal government for the next 10 years, the number of legislators we have representing us in Congress, is all determined by census data provided by every person in this country. If New York City falls behind where it should be, and apparently that's where we are, behind where we should be, we will get less money from the federal government and less representation for the next decade. And we only have about a month and a half to reverse this because they've actually made it a month shorter for the deadline of response. It was going to be the end of October, and now we only have till September 30th for every single household in New York City to fill out their census. And there's a lot of ways you can do it. You can do it by the material you got in the mail. Maybe you lost that already. You can go to 2020census.gov, 2020census.gov, or you can call 844-330-2020 to complete your application form, You might have filled it out wrong. What am I talking about? Well, because of COVID, lots of people who live in my district left my district for what they thought at least were safer or, I guess, more outdoor options for themselves. We have people living on the tip of Long Island. We have people in Florida. I bet they're wondering why right now. We have people in Arizona and California, also perhaps wondering why right now. They're there instead of here. Their census materials might have followed them there. They might have read the paperwork and thought they were supposed to fill it out as if they lived in Florida or California or Arizona or Long Island. Wrong. If your primary residence is here in New York City, you need to fill it out as if you live in New York City, because you do, even though you may be sheltered somewhere else for now. So if you think you made a mistake, fill it out again and tell the census you want this one to be used with your New York City address. Every person has to be counted. Every child, every adult, every roommate, every grandchild who might be living with you. It doesn't matter whether they have legal status or not. It doesn't matter whether they're here on a visitor's visa. If they're living in New York City, we need them to be included in census information. And again, if you're confused, you can call us up and get clarification. You can call the census phone number, get clarification. If you're watching the event on Facebook, we'll post a link for you to fill out the census right now and a link to correct your census just now. Again, I can't emphasize it enough. There's no excuse to not fill out the census because it affects whether our school children have money for education, whether we have enough funding for Older Adults Act money, Americans with Disability Act money. It's all based on the formula of how many people the federal government sees as being here in our city and state. So I'll just leave it there without yelling at you. But you must fill out your census forms, and there's no time left. You really have only till the end of September, which is around the corner, believe it or not. All right, getting to this evening's event. This evening, we're going to have a conversation about the connection between ageism and ableism. Some people don't know the word ableism. It translates into discrimination against people with disabilities. We're going to talk about it in the context of the world we're living in right now, the world of COVID. In the spirit of Dr. Ruth, our speakers will address how we can challenge assumptions about the roles older people and people with disabilities play in the workforce, in our communities, and in the broader culture. Now, all of us participating tonight fall on the older person end of the spectrum compared to the younger person end of the spectrum. But I will tell you that in response to simply advertising this event, I got a wonderful video sent to me that was too long to play tonight by a young disabled 10-year-old living in my district who had done as a school project this year a public service announcement about ableism and the issues of being a disabled young person. And it was so well done, and it was such an important message that I wish we had time to play it tonight, but it was not a short PSA, it was an in-depth presentation. But just want to shout out to him, and he should be proud, and his parents and his teachers should be proud. First, we're going to hear from someone that I have worked with before, and she's an extraordinary writer and presenter. Her name is Ashton Applewhite. She is an internationally recognized ageism expert and the author of This Chair Rocks, an excellent book, and she has websites, and you can find her, and you will see how accessible she is. Ashton's going to help by defining ageism and ableism and explain the connection between the two. Then we will hear from Peter Slatin, president and founder of the Slatin Group, which provides education and training to the hospitality and tourism industry on services to consumers with disabilities and writes for Forbes magazine about disability issues. He just wrote something about Tammy Duckworth and perceptions about people with disabilities as whether they are serious contenders for vice president at the moment. After the presentations, I will moderate a Q&A. We have questions that were submitted in advance and that you can also, if you know, submit your questions through Facebook. Oh, I forgot to say something very important. There's two different ways you might be watching this tonight. One is you're on Facebook, which means you know that you can write in things, but you actually can't interrupt. If you're calling in and listening that way, and many people do each week, you have to keep your phone on mute. Please, please, please. This is not an interactive webinar where you get to jump in with your own questions and discussion. You could have filled in questions before tonight. You can follow up with my office afterwards, but please keep your phone on mute. Thank you. It is now my pleasure to introduce Ashton Applewhite. Hi, Ashton.
Hi, Liz. Thank you for that fantastic introduction. I want you to know that I nagged my children to complete the census, and they promised that they did. And also, even though I couldn't hear Ruth Westheimer, I'm going to brag for the rest of my life that I appeared on the same bill with Ruth. Do you think that's legit? I'm
Totally,
such a fan.
totally.
Good, good. I got the clear. All right. So, if you think about how most of us feel about getting older, it doesn't take a lot of head scratching to realize that a lot of our apprehension is rooted in fear of becoming disabled, of losing some physical or cognitive capacity, which is human. But even though that's true, we act as though old people never become disabled and disabled people never grow old. And, part of the reluctance is just human. It is scary to think about our minds and bodies functioning less well. And part of the reason is that people in the aging field resist, quite rightly, the equation of oldness with disability. Not every person ages into disability, and they are not the same. Just as illness and disability are not the same. People with disabilities will assure you that they are not sick. But people often conflate the two. And of course, disability and aging are different, but they also overlap in important ways. And I think it's really important to think about those in our personal life and our public lives and build on them. Both olders and people with disabilities, who are of course often the same person, encounter discrimination and prejudice. And both groups face stigma. Many olders refuse to leave their home if it means using a walker or a wheelchair, because the stigma is so great. Even if they never go out. I heard a heartbreaking story about an older man on the Upper West Side who used to go around to all the restaurants and he brought toys and played with the kids, and he encountered some, I don't know whether it was an accident or an illness that required him to use a wheelchair, and he never did it again. So, and of course, there is also the taint of age for people with disabilities. A good friend of mine was not yet 40 when she broke a bone in her foot, and she didn't want to use a cane, because a cane signals old, right? She opted for crutches because they signal injured, not old, not disabled. I think of that as the long shadow of all those horrible traffic signs with the old lady and the old guy hunched over a cane. And of course, cognitive impairment is even more stigmatized. Being older or having a disability doesn't keep us from being ageist or ableist, which means having prejudice or preconceived ideas about people because of their age or because of an assumption we make about their physical or cognitive function, right? Those are those two prejudices. Age cooties, disabilities make me uncomfortable. That's how prejudice works. It frames the other group as alien from ourselves, right? As different, or at least what we think of as the other group, even though we may in fact belong to it. And when it's alien, then their rights become less important to us, and we distance ourselves from them and their well-being. And this makes no sense because people with disabilities come in all ages, as we learned from Liz's 10-year-old constituent. And all of us, lucky to live long enough, will age into some degree of disability. It's true that most older people are not disabled if you think of the magic number of 65 on up, but the longer you live, and the rates increase sharply north of 80. Healthy aging can and does involve impairment. It already has for me. People age well, not by avoiding illness and disability, but by adapting to it. So I have been talking for years about the need to stop ignoring this overlap. And then along came COVID, and it really exposed how deeply ageism and ableism are intertwined. Think about the early message that came with the pandemic. Don't worry, the virus will only affect the old and the ill. That's why some countries decided that the threat was, quote, less worthy of the best efforts to contain it. That's a quote from the head of the World Health Organization. So here's a thought experiment. What would the infection rate or the death rate, the numbers, pick a number, look like if we had known from the beginning that COVID would also affect young and healthy people? Very different. So think about that if people don't think that ageism and ableism are important. That is their lethal global impact. According to the Center for Disease Control and Prevention, 8 out of 10 COVID-19 related deaths reported in the US have been of people age 65 and up. According to NPR, Americans with intellectual disabilities are far more likely to contract the virus than other people, and at least twice as likely to die from it. Many of these people live in facilities that provide skilled nursing care, as do many olders, and these populations, again, of course, overlap. And almost half of COVID-19 deaths in the US are linked to nursing homes. COVID has done more than expose the way ageism and ableism intersect. It has exposed the intersectional nature of vulnerability itself. And it would be remiss of me to omit the far higher risk that COVID presents for Black and Latinx people. And this fact went unmentioned for weeks at the beginning of the outbreak. In all age categories, Black and Latinx people are dying at much higher rates than white people. Nursing homes, this is interesting. It's all interesting, but that have a significant number of Black and Latinx residents have been twice as likely to be hit by coronavirus as ones with predominantly white residents. And it doesn't matter where they are, how big they are, or how they're rated. That's the interesting point. It's just a function of having fewer, more residents of color. And the people who work in nursing homes are so ill paid that most have to work more than one job, so that increases their risk of being exposed to the disease and exposing the people they work with. And most of those essential workers are women of color. So the pandemic has really brought our attitudes towards age and aging center stage, but it's clear that existing bigger picture health inequalities and what determines them, like race and class, put people at much greater risk than age alone. So back to ageism, where my expertise lies, because Peter's going to handle the ableism part of it. Ageism is discrimination and stereotyping on the basis of age, and we experience it anytime someone assumes that we are too old, air quotes around that, for something, instead of finding out who we are, what we're capable of, what we're interested in. Could also be too young. It's any judgment on the basis of age, although young people experience a lot of it. So ableism, I'll define it for you, Peter, so you don't have to do the heavy lifting and can get right to the sexy part, is discrimination and prejudice against people with disabilities. It is the belief that being non-disabled is normal, in quotes, and preferable, and that disabilities keep people from leading meaningful, desirable lives. We're being ageist anytime we judge someone on the basis of how old we think they are, and we're being ableist when we judge them on the basis of how we assume their minds or bodies function and how they experience that. We're all ageist, and we're all ableist. No judgment. From childhood on, after all, we are barraged by negative messages about how awful it is to grow old and how tragic it is to be disabled. And unless we stop to question these values, they become part of our identity. That's internalized bias, and that is why so many of us reject a helping hand, or try and pass for younger or non-disabled, or are offended when someone politely offers us a seat on the bus. Right? We've all done it. The very first step is to examine our own attitudes, because we can't challenge bias unless we're aware of it. And this is the work of a lifetime, no judgment. When an acoustic neuroma destroyed most of the hearing in my left ear, I caught myself thinking, at least it's sexy brain tumor deafness instead of sad old person deafness, which makes me both ageist and ableist. For we olders, these biases are deeply intertwined, and they feed shame and denial about something that we shouldn't feel embarrassed by. And that is why we go, so many of us, to such great lengths to try and look and move like younger, fitter, stronger versions of ourselves. So back to COVID, what are some examples of internalized bias when the pandemic hit? Well, one is older people who were reluctant to acknowledge that we belong to a high-risk group. That's biology, not bias, and proved it by taking risks, by going out, and doing risky behavior, especially in the early days, because they didn't want to acknowledge it's hard to acknowledge vulnerability. There was a journalist in Boston who interviewed me. She's the same age as me, 68. And she had been planning to check on her neighbors who had a newborn, and she was offended when they dropped by, quite taken aback when they looked in on her first, because it hadn't occurred to her that they would see her as perhaps needing a little checking on. So what are some examples of structural, systemic ageism and ableism exposed by the pandemic? Some really horrible discourse, like a Telegraph, the British paper, a journalist suggested that COVID could benefit the British economy by culling older Britons. Or the famous anecdote by the Texas lieutenant governor who suggested that grandparents should off themselves for the benefit of the stock market. After you, Mr. Patrick. Stereotyping older people as a homogenous group, all of whose members are frail and helpless. We see this over and over. In fact, and if there's one fact that I hope you take away from tonight from me, it is the fact that the longer we live, the more different from each other we become, right? Right? Heterogeneity. All 7-year-olds are different, but they're way more alike physically, developmentally, socially than 27-year-olds who are way more alike than 57-year-olds and so on. So the older a person is, the less their age tells us about how their brains or bodies work. Another horrible example of ageism and ableism in the face of COVID, the appalling abandonment of elders and people with disabilities in care facilities. Society that doesn't value its older members doesn't care about the people who work with us either. So think about the toll also on their caregivers, most of whom are underpaid women of color. And probably the most blanket example is basing health policy on age, like access to care or stay-at-home orders. This stigmatizes age alone, and it is racist and classist too, because it overlooks the structural barriers to health equity that put people like those underpaid caregivers at risk. When you impose an age cutoff, it not only discriminates against people over that age who are fit and healthy, some 70-year-olds are way fitter than some 40-year-olds, it also discriminates against people younger than that age who are at risk. And when we omit younger people from health advisories, that's another form of ageism against younger people, right? That's one reason I think that so many young people, when the pandemic started to really sweep through the Southwest and the South, a lot of the victims were much younger, and I think they just didn't think they'd get sick because they were, health advisories left them out. So there's been a lot of hand-wringing around this, as usual, or with anything to do with aging and disability, with a lot of people saying, hey, COVID is making ageism and ableism worse. That's, I submit, not the best way to think about it. It's not making prejudices worse. It is exposing the ageism and ableism, the prejudice against older people and people with disabilities that have been there all along. And it is awareness and outrage that are on the rise. And that gives us a historic opportunity to build on that awareness. And I like to think we're getting a nice boost from the Black Lives Matter movement too.
And I'm going to cut you off at exactly that statement, okay, just because of time, and I'm sorry, but thank you.
That's fine.
And I think it's a perfect roll into handing it to Peter Slatin, who is going to be talking about moving from the contagion model to a new framework where we integrate older adults and people with disabilities more completely and more fairly into society. So thank you also for being with us tonight, Peter.
Thank you. Thank you for having me, and thanks for saying what I'm going to say so I don't have to say it anymore. But I want to thank Ashton. I also want to thank Dr. Ruth and technology for this amazing example of what it's like to be deaf for all of us who are paying attention. Anyone who's part of this audience who is profoundly deaf knows what it's like to hear nothing and not know what's going on. And so that was that awkward moment we were all sitting in, wondering what was going on. And I guess some of you saw Dr. Ruth. Now, I'm in the fortunate position of being blind at age 65, almost 66, so I no longer have to choose between whether someone treats me in an ageist or an ableist way. I can, take it both. And please, Senator Krueger, could you please get the permission of his parents first, but forward me that PSA. I'd
like to see it too.
Absolutely.
So, where to begin? We can begin with the ways that ageism and ableism, more ways in which they are similar. And one way in which they're different is that you can say that some people will say the only thing worse than getting old is not getting old, not having the opportunity to get old. So everyone, fortunately, who is old has gotten there by dint of living, surviving, and people with disabilities often don't survive. They, it's just many people with disabilities have multiple disabilities, and all kinds of just internal challenges. But I think the place that really is the crux of this is where Ashton brought in the idea of fear. And I refer to it as the contagion response. And the pandemic has really highlighted that for us. The pandemic is like, I like to say it's like when we go to the doctor and we have a serious condition and the doctor wants to find out what it is, and we get injected with a dye, and through x-rays or other machines, they can see where the dye flows to where the diseases are in our body. Well, the pandemic is acting like that in society and highlighting the diseases in the systemic disease of racism and ageism and ableism. And again, I'm not going to equate racism and the centuries-long degrading of African Americans and other people of color to what we experience in ageism and ableism, which actually are centuries old also, but just in a different way. And but that's how society looks at us. And when we try and survive in a culture that's not been designed for us, and it's not been designed for old people, and it's not been designed for people with disabilities, and the reason it's not been designed for old people is, as Ashton said, they're expected to step out of the way, be done, move on, or move over, really, when they reach a certain age. And that certain age has been moving. It's a moving target as we live longer lives, and yet it is still someplace where we're supposed to really step off stage. And the idea that we are not even on stage, not part of this production of life anymore, is very much what people with disabilities experience every day of our lives, where we know that people don't pay attention to us or don't acknowledge us. As I often go to restaurants with my wife or with other people, and the waiter will often say, "What is he having?" And I'm sure, as an older person, some of you may have experienced that if you're out to dinner with your grandchildren or your children or just younger friends. It's just what happens. So another way that disabilities and the pandemic have and older people have been brought together by the pandemic, and actually have also helped the rest of society understand the challenges of a group, whether it's the disabled or the older people, who have basically been pushed aside or shut out for a long time, and historically, is that now people who are not disabled, and the non-disabled and the non-old, people who are used to going out every day and being in the mix, working and being on stage, suddenly find the stage is closed, and literally on Broadway. But we in the disabled community are used to being isolated. We're accustomed to isolation because for many things we have to wait until someone can help us with some things. Of course, we all love to be and strive to be as independent as possible, but at some point we have to request assistance. And it's learning where and when to do that is the key, not only to successful life as someone with a disability, but I think also a successful life in older years, for olders, because we all need help to do something. No person is an island, and we go through life needing help in various places in our lives, but with these conditions, we really need more help. But just asking for it does not signal helplessness. It signals desire actually more to be independent, to be as self-sufficient as possible, with a boost, You know, the isolation that comes with disability stems from decades, centuries really, of people with disabilities being taken as a threat, being seen as a threat to the community at large. Because just as the pandemic and the coronavirus is catching, it's contagious. Disabilities historically, some are of course are inherited and just in our being as we're born and grow, and some of them are acquired through accident. But some are contagious. Polio, of course, is a classic example of a contagion that ravaged generations. Measles has that potential. So does actually so does the pandemic, which can ravage lungs and cause brain injury, and we just really don't know what the coronavirus will do to us. And we also know that Ashton told some pretty horrific stories, but I think the most horrific way we can illustrate the way society views the olders and people with disabilities is to think about the Nazi eugenics program, which targeted these populations before even turning to the Jews and other non-Aryans. And this is really what we heard from Lieutenant Governor Patrick in Texas, who suggested that we might be the most easily disposed of. Now, I just wrote today on Forbes.com, and I think you can see the article on Senator Krueger's Facebook page. But I wrote about a part of the bill that the Senate is pretending to work on to the next version of the pandemic relief bill, and a little known and little discussed provision of that bill actually guts the Americans with Disabilities Act and several other, I'll call them human-centered acts, worker-centered acts. It also guts the age in employment and discrimination in age. And now I'm showing my age. No, Age in Employment and Discrimination Act of 1967, which really has supported the employment of people of age, people who are older than your typical young buck trying to get a nice job on Wall Street. And so we see the government, the Republican senators really, they've chased for years trying to get rid of the Affordable Care Act, and even longer they've been trying to gut the Americans with Disabilities Act, which is now 30 years old. And for this provision to be inserted into a bill right now, sort of buried in it as a way of protecting employers, protecting schools, protecting hospitals against liability for discrimination, is really a slap in the face. And Senator Duckworth called it a war being declared on the ADA by the Republican Senate. And I think it's really important to, along with filling out the census, to call our senators and let them know not to let this stand. So, there are three legs to achieving equality, whether it's equality as a person with a disability or equality as we age. And we all hear about accessibility, and accessibility is really critical for older people as well as for people with disabilities. And we need accessibility in three ways. We need it physically. We need to be able to get around, whether we're using a walker or a wheelchair or a white cane. We need to be able to use the web. That's digital accessibility, and there's lots of malfeasance in that area and thousands of lawsuits against digital the lack of digital accessibility. But to me, the final frontier is social accessibility, and that's really what we're talking about here tonight: is the lack of social access, the fear that comes over people when they see us, their immediate instinct to withdraw and hide and not catch what we have. You know, and with the fear, Ashton also talked about shame, the shame of being seen in your walker, with your walker, or in your wheelchair, the shame of being exposed as a more frail, older person, and having so-called perfect clear skin, which is just so odd, because skin can be beautiful at any age and in any condition. I remember one time, and this is really a terrible story that just popped into my mind. I walked into a coffee shop at the Sheraton Hotel in Midtown, the big Sheraton, and it was evening, and the lobby was packed with people. And my friend said, "This is strange. Everybody in here is covering their face, not with a burqa. It wasn't a Muslim convention, but everyone is shielding their faces." And finally, I just asked someone, I understand that everyone's face is shielded, and she said, "This is the annual burn victims congress."
Oh, wow.
And so these are people who have spent their lives, or some portion of their lives, in fear of being seen, because that sight generates repulsion in others. And that's an extreme example, but we feel as we age, as we lose our hair, some of us, not everyone, that people don't want to see us in that condition. They don't want to see us less than or weakened. And we're less than what? Less than who we were? I don't know. I don't think so. I think, as Liz said, we are different from who we were. We are different from each other, and we can find strength. We should find strength in those differences, in learning to be who we are. I'm finding every day that I'm stronger and feel more aware of my personhood than I ever have been. And I am extremely grateful for that. I have seen young blind people, talk about how, and these are people who are born blind, talk about their shame and fear at leaving their own home when they were young with the love of their parents as a blind person. They learned shame going out, being exposed with their canes, holding on to someone. And so the shame is part of us. And when I talk about, as Liz mentioned, I talk about changing the framework and the structure of what we look at, so that instead of separating us from the non-disabled and the young to the disabled and the old, we are really one people, and we each have something unique. We all experience age in a unique way. We experience disability in a unique way, and we experience our lives in our own unique way, and that transfers to disability and aging. These are characteristics of who we are, but we can be proud of them, and we can learn from them. And people who are older or who have a disability get hired to work in an environment with other people who don't have those traits, then we bring something to the table that they can only guess at. And it's really, I'm sure it's amazing to some of you to what you can bring to a group of young people who really haven't had the opportunity to think from your vantage point. So that's really the point. We do need to just shed these preconceptions, and it's the preconceptions, the low expectations, the generations of isolation that have to be gotten rid of. And part of it will happen through what is now the ADA generation. That young man who sent you the video, Liz, he is part of a generation, the first generations in America, in the world really, born into a world where people with disabilities don't get a memo at birth saying, stay away from me. You don't
That
belong.
is exactly where I want to move into questions,
Thank
if
you.
that's
Yes.
okay with you, Peter. So I'm glad you circled back to the young man, because, and this is a question for both of you, because it could be, any storyline. And I'm always fighting to try to make our laws better and more fair and equitable. And one of the issues that's been raised a number of times is, can we avoid having people have to give their age or other information about a disability, during a job interview, because we don't want them discriminated against in employment, and those are employment discrimination, very real for both people above a certain age and people with a disability. But is there an argument for just being straightforward, as Ashton said before? Okay, I'm X age and I'm applying for this job, and I have additional skills because of all my experience in the workplace over the years. Or I have Y disability. Here's why I think it actually makes me a better employee. I once had a young man come for a job interview, and he told me that his mother didn't think he would succeed in a job interview because he had very serious OCD. So he decided to approach this by saying to me, I have very serious OCD.
That's right.
I think it will make me a better employee. I always have a clean desk. I can't bear to have anything not completed, so I tend to complete things quickly and efficiently, and then want more things to do because of my OCD. And you know what? We hired that young man into my office, and he was one of the best employees ever. And I thought, wow, I might have thought him a little socially uncomfortable if he didn't tell me I have serious OCD. Now, obviously, if someone is older, I'm probably going to see that without them saying something to me. But what's both of your opinion about fighting for more protections that nobody has the right to ask questions, or fighting for more openness to be accepted because we have perhaps added value in employment situations? What's your gut?
Ashton, go for it.
Thank you, Peter. I think it's important not to pass judgment on what people do. It's hard to get a job. It's hard if you have a disability. It's hard if you're older. It's especially harder if you're a woman. It's especially harder if you're a person of color, and so on. So if you got to get that job, no judgment if you leave early accomplishments off your resume, fudge your age or whatever. But that behavior is not good for us because it's rooted in shame about something that shouldn't be shameful. And the reason I'm an activist is I'm working to try and help catalyze a mass movement that really provokes a mass change of consciousness in the culture as a whole. Until we do that, until each of us between our ears starts thinking differently about how we look and move and feel, right, and takes that out into the world as part of our identity, we give a pass to the discrimination that makes those behaviors necessary. So each time one of us is able to say, I'm 68 and I would kill, I'd be fantastic at this job, or, I'm whatever that thing happens to be, we do chip away at people's prejudices, but we can't all afford to, and it's a risk.
Yes, and I speak to people almost every day, people with disabilities I know a lot of young people who are out there looking for jobs, and I know a lot of older people who are out there looking for jobs, and the question comes up in every conversation. Should I acknowledge? Should I come out? What should I do? And
coming out.
I think it's just so sad that this is something that people have to think about. And I think your story, Liz, about this young man is the best of all possible worlds, where he faced down his mother's low expectations, which were rooted in fear and love, simultaneously, but he faced them down and went out and he turned his supposed disadvantage to his advantage. And
let's remember that the culture does change. I have a friend who's now she's almost 50 and she's gay. And she said, when I started out looking for jobs, I was out about my age, but I hid my sexual, identity, my and now she said I come right out and lead with I'm gay, but I don't want to reveal my age.
well, soon she'll be old and gay, so
Right.
There we go.
There you go.
Not old and gay, but
So one of the questions here is actually rolls into sort of it's not a third category because we define it as a disability, but people with concerned about having psychological and mental health disabilities and what their role is in society or how society looks at them differently, and perhaps some advice about, what they should be trying to do to get back out into the world and not feel that there'll be so much discrimination, it's almost not even worth giving it a try.
all right. Well, there's someone who has a lot to deal with, and yes, he or she is absolutely correct. It's almost not worth doing it, but in the end, it's worth doing it because there are options out there. But I'm glad that person used the term mental health rather than mental illness. You drew that distinction earlier. Mental illness that's one thing. Our mental health is something that we carry with us no matter what, and there are options to reintegrate or move into society. I remember this person said that they'd been in New York City for 56 years, I believe, and even 10 years ago, there weren't the options that there are now. Cultural organizations all over the city are beginning to create programs, whether it's theater programs, dance programs, museum classes, art education for people with invisible disabilities of all ages. And I recently wrote about some of the museum programs, including one at MoMA, where they originally set up they have it, I think, third Sunday of every month. And of course, that already highlights that it's not frequent enough and there aren't enough of these. But they originally thought they would separate the youngsters and the oldsters because they wouldn't want to be with each other. But perhaps because of these mental disabilities, invisible, cognitive, developmental, whatever you want to label them, they're already fighting against something and don't need to worry with each other about perception and those low expectations and what people think of them. So it turned out that both of these classes wanted to be with the other class, and they had to take away what they'd used the movable wall to separate the classes and let everyone be together. So there are, just quickly, places to go if you research online for classes, but it still is a struggle.
Thank you. So, Ashton, you've mentioned, I think, in other forums, and maybe you did say it earlier tonight, the concept of the mythical norm. What did you mean by that, and how is that concept relevant to our discussion today?
The mythical norm is the phrase attributed to Audre Lorde, who was a fantastic African American lesbian poet and activist who died tragically young of cancer. And she refers to the mythical norm, which she describes, I believe, as the ideal, the social ideal: young, white, male, cisgendered, meaning you identify with the body that you're born into. You feel like you're the right gender at birth. Heterosexual, Christian, and well off, reasonably well off, self-supporting. And that is the mythical norm that society that doorways are designed for, that office temperatures are set for, that clinical trials, drug trials, almost all drugs are based on that, healthy young white guy. So the further we fall from that ideal, the less white, the less thin, the less young, the less cis, the less all of this, the more disadvantages we face in getting an equal shake at society. So I think that's a very powerful idea.
This just to add on to that and to dovetail with another question that came to us ahead of time. The one way to avoid the mythical norm is to become the mythical super blind or super disabled or super older, person. And climb Everest with one hand tied behind your back using your teeth.
Super geezer.
Tampons. And,
Yeah, I coined the term super geezer in my book because I knew that the disability community had coined the term super crip, appropriating the word cripple to take pride in it and to reject the idea that it was shameful and it was denigrating. And of course, there's this ideal that you have to overcome and transcend your disability. And I think for younger people, they have come of age in an era where you claim your disability as part of your identity, that you are who you are because of it. There's no shame in it. And I think that's something we older people, whether or not we are disabled or whether we age into it, could learn a tremendous amount from how these younger people reject shame and instead, move powerfully as disabled people in the world.
Right. We're getting later than I imagined, so I want to definitely get in these last two questions for each of you. One, what advocacy efforts or organizations to fight ageism or ableism should we know about? And then two, what's next on each of your advocacy agendas?
I can give a really short answer to the ageism piece. You can find a lot on my website, which is thischairrocks.com. My book is coming out in paperback next week, so that's nice. And it's not free, but almost everything on my website is. And go to a website that I created with two friends called Old School. It's the Old School Clearinghouse of free vetted anti-ageism resources, books, videos, consciousness-raising guides, toolkits, all kinds of stuff. Everything is free except the books. The website is oldschool.info. Movements need tools. Find yours there.
Okay. Peter?
Yes, thank you. With disabilities, I think one of the big lacks in the disability community are really cross-disability advocacy groups. There are very few, and people tend to go to their own. I'm a member of the National Federation of the Blind, and of course I know people in many other organizations, but the hearing health organizations and the American Association for People with Disabilities is really much more about people with invisible disabilities than people with physical disabilities. And until that changes, unless you are a super duper geezer and you can have the will to make this change happen and form your own cross-disability organization, I recommend that. As for advocacy, I will just continue to seek to create social access, to tear down the barriers of low expectations and fear and the contagion response, and so that people learn that we are just people. So that's advocacy in voting, advocacy in education and employment. Those are the really, unless you can get a good education and good employment, society will not, you can't get into society and society won't take you. So that's where it needs to really happen.
Well, I know it seems impossible that an hour has come and gone, but I want to thank both of you profusely for joining with us tonight. I think that the messages you send the examples you give from yourselves, the identification I think we all automatically have listening to you and your experiences are so valuable for us. And for us to remember to think in new ways about how these issues are impacting us personally, impacting people we love, and hopefully make us think a little harder about how we do react to and treat people in our day-to-day interactions, because I think we are definitely talking about needing culture changes. And it's
Yes,
culture
we
changes
are.
for an enormous percentage of the American public. So everyone who thinks life just doesn't change all the time, guess what? You're wrong. This year in COVID, it's changing faster than most of us can even cope with on a day-to-day basis. But there are constructive and useful lessons that can make us come out the other side better. So again, thank you, Ashton. Thank you, Peter. Our next town hall is scheduled for Thursday, August 20th, 7 p.m. And there we will have joining us Dana Sussman, who's the Deputy Commissioner for Policy and Intergovernmental Affairs at the New York City Commission on Human Rights. I've worked with Dana on a number of important issues, and I'm just so impressed with the work the Commission does on behalf of all of us. But she's going to be rolling out the new guidance on age discrimination in the workplace, which I am excited about, that we now have some excellent guidance on dealing with these issues for employers and employees in New York City. I hope to take that model statewide. Dana will be explaining the guidance legal framework and best practices in hiring and managing multi-generational workforce. So again, stay well, stay safe, wear a face mask over your nose and mouth to help keep others safe as well as you. Just keep washing your hand, change the song so that you don't get bored with the 20 seconds of soap and water, and know that we're going to get past all this, folks, and we're going to be able to see each other eventually and even hug each other like normal people again. So again, thank you so much. Thank you everyone for joining us tonight. And again, good luck.
Thank you.
Thank
Bye.
you. Bye.
Bye-bye. Night.
Thank you so much.